Hello, I'm Calvin Thigpen. I'm the Program Director for the Internal Medicine Residency at the University of Mississippi Medical Center. I've been a part of this program ever since I was a third-year medical student and rotated through on my clerkship. And ever since then, what has drawn me to this program, both in the decision to join it as a resident and in the decision to remain on the faculty here at the university, is the people.
I interviewed for residency all over the country, really. You know, as you go through your interviews, you tend to latch on to places that the people just make an impact on you, the location makes an impact on you, and for whatever reason I felt that here in Mississippi.
Mississippi is known for its southern hospitality, and the internal medicine residency program is no different than that.
The people have had such a strong influence on my life, have made me into the person that I am today, to the doctor that I am today, and I think that is true now for our residents as well. There are three big things that we talk about with our residents in their development, and that is having a growth mindset, a team mentality, and a passion for doing what's right for the patient who's in front of them.
We're a huge family here. You know, I have most of my attendings' cell phone numbers programmed in my phone and text them even if it's not about medicine stuff.
The attendings here, excellent at teaching, and all of the staff here, even down to the nurses, are willing to, hey, this is how we do this thing, maybe you could try this thing. Always having structured lectures, always having time every day to be able to study, to learn.
The staff and the faculty here are super approachable, and I felt like I was really able to pick up the phone and call somebody.
I started off in the ICU on my second month, going into nights, and you have to make those big decisions. And thankfully we have such a good fellowship around us. You can easily reach out to upper levels, which helped out a lot.
Meeting the people here, and everybody here seemed to be team motivated. They all seem to have, the patient in mind.
Hasn't been a day in the past 2 years that I didn't feel like I could pick up the phone and call my upper levels, my staff, or even a program director directly to ask them a question right on the spot. It's important to be able to have that support.
All of our program leadership are very approachable and very receptive to feedback. In fact, they ask for it quite frequently.
One of the things I particularly love is education. I'm very proud and grateful from everything I've learned from this program and from all of my teachers, my fellow residents, and my attendings. We have great teachers throughout all years, and they've really inspired me in my own career to pursue academic medicine.
Being from Mississippi, we take care of some of the sickest people in the nation. You really will see a huge diversity of illnesses to take care of and get to know some of the sweetest and most appreciative patients. It's a real blessing to have the opportunity to take care of them.
When I was looking for a residency program, I wanted to make sure that I chose somewhere that would give me training to see common pathology as well as rare, diverse pathology, and I found that here at UMC.
The pathology here, I know it sounds that's probably pretty nerdy, but you'll see a little bit of everything, diagnose things from amyloid to press, and just like, hey, you don't see those very often, but you get to see a lot of that stuff here.
I learned a lot from the faculty here about focusing on every patient specifically, and we learn a lot of guidelines and therapies to treat patients, but we also try to direct our care specifically to each patient in their own ways.
It's very obvious when you have a genuine camaraderie, and our residents really liked each other. They actually hung out on the weekends. They weren't just saying that.
Most of my friends that I spend time with after hours or on weekends are people that I have met here at UMMC and worked alongside. In fact, met my wife here on one of my rotations.
I'm sure everywhere has a great place or a lounge for the residents to hang out, but ours is kind of a pillar for our program. We always know we can go in there and sit on the couch and talk to whoever's in there and have something in common, and always know that we have a friend there. Everyone's available and everyone's great friends, which is a really strong point of this program, I think.
Living in Mississippi is definitely comfortable. It's a family place.
Me and my wife, we just love the area. Mississippi has a lot to offer, probably more than you think, more than I thought, that's for sure. I like history, I like music, I like food, I like culture, and all of that is in Mississippi.
Yeah, so around Jackson, there's a lot to do. I grew up here. There's a lot of great restaurants. Outdoor stuff is great. We have the reservoir near us and the Natchez Trace that has a lot of great parks and walking trails and things like that.
A lot of the residents get together. There's a lot of golf courses that we do golfing at. We tend to play a lot of sports.
Have a mountain bike a lot, go out to the res, have some friends who have boats, get some friends who have boats.
So UMC was a no-brainer for me. You're not on your own here. We feel a lot of pressure to know all the answers right away, but you have a team that you can reach up to and they're happy to help.
And I think in my training specifically, it had made me become a better doctor, being able to just even know that I could pick up the phone and call anybody and that they're available for help.
Everybody here is very willing to help and willing to teach. Nobody's gonna knock you over the head as an intern because you didn't know an answer. That's one of the things I picked up pretty early is that people here are genuinely interested in making sure you become the best doctor you can be.
I think, you would love it here, and I've loved it here, and I can't wait for the next couple years of my training.
If you want a place where you feel supported, and if you really want to have a unique patient population where you are hands-on, making clinical decisions, doing procedures, and really pushing yourself forward every day, then this is the program for you, for sure.
Now, all of these things together blend to make our program what it is, and really it all goes back to our people. Our vision is to educate, inspire, serve. And not only do our residents do that on a daily basis with their patients, they do that with each other, they do that with their medical students, and in carrying that out, they also reflect our 5 core values, and that's scholarship, integrity, diversity, purpose, and excellence. All in all, there has never been a time in my career when I've had regrets about being a part of this program. And I think the same is true for all those who've decided to do their residency here. And that is the main message that I'd like to send to our students or to anybody who's thinking about the possibility of furthering their training, starting their career here at the University of Mississippi.